Welcome back to Catalyst University. My name is Kevin Tokoph, and in this video, we're going to be discussing exercises for the piriformis muscle and really the entire hip external rotator group. Those are going to be stretches and strengthening exercises. Now, throughout this video, I'm probably going to mention piriformis, but realistically, unless I'm talking specifically about piriformis syndrome, I'm really referring to the entire hip external rotator group. When you are stretching the piriformis or you are strengthening the piriformis, you cannot isolate that muscle. No matter what anyone says on the internet, you cannot isolate the piriformis at all. So you are really working, however it be, with stretches or strengthening, the entire hip external rotator group. But for the sake of simplicity, I'm probably just going to refer to it as the piriformis. Okay? Now, if you've been online long enough, whether it's social media, YouTube, you've probably heard this one statement, at least once. Don't stretch your piriformis. That's in reference to piriformis syndrome. Now, as a brief review, you've got the piriformis muscle, and the sciatic nerve runs right under it, or in some people, it actually pierces through the muscle belly of the piriformis. And then theoretically, when that muscle is tight, you get some kind of impingement or chemical irritation of the sciatic nerve, and you end up with symptoms down the back of the leg, sometimes going down as far as to the foot. That is piriformis syndrome. And what they say is that don't stretch your piriformis. It's actually weak, and you need to strengthen your piriformis. Well, here's the thing. It depends. That's the most common answer you get in physical therapy. It depends. How do you know exactly what to do with the piriformis? Well, first of all, you need to do a flexibility test, and you can do this in a multitude of ways. You can actually look at hip external rotation range of motion. You can look at hip internal rotation range of motion. And you can also do a Faber test. Any one of those three tests is going to give you good information on the flexibility state of the piriformis. That will tell you if it's tight, first of all. And if somebody has piriformis syndrome, some of those tests are likely to reproduce symptoms going down the leg, whether it be numbness, tingling, or shooting pain. Now, in terms of strength, how do you determine that? You do strength testing. Now, if you're doing it the old-fashioned way, you can do manual muscle testing with your hand. If you have a handheld dynamometer, this is really the best plan of action because it gives you exact pounds or kilograms of force. Now, when I measure hip external rotation strength, I do it in the clamshell position. And we're going to cover that in other videos on how exactly we go about doing the strength testing. But it suffices to say for now, we do it in the clamshell position, not the standard one where you're sitting on the edge of the table and moving your legs like that. Okay? Do it in the clamshell position. How do you know if it's weak? Well, a good rule of thumb is that if you look at the quadricep to hamstring ratio, what they say is it should be 3-2. So for every 3 pounds of quad force, you have 2 pounds of hamstring force. Now, West Side Barbell would argue that the hamstring should be just as strong as the quadriceps, and I tend to agree with that. But for the sake of the argument, it's 3-2. So to make the math easy, let's say the quadriceps have 90 pounds of force and the hamstrings have 60. Well, the gluteus medius, so hip abduction, and hip extension should be about on par with the hamstrings. So if the hamstrings are 60, the hip abduction and extension strength should also be about 60. Hip external rotation in the clamshell position, from what I have seen in most people when we get them totally better, is a little bit higher than abduction. So if abduction is 60, I might expect for external rotation 65, maybe even as high as 70. This is what you typically see in younger people. As people get older, especially with higher BMIs, you don't tend to get as much strength in those muscles, so you might expect a little bit less. But in somebody who's in their 20s, 30s, 40s, those values, I would say, are pretty good to go off of. Now, 9 times out of 10, and possibly even more, what we see in the clinic is that the piriformis is both weak and tight. And that is potentially contributing to, let's say, piriformis syndrome and symptoms going down the leg. So what do? Well, you do what works for the patient. Physical therapy does not have to be complicated. In fact, I have found that for the vast majority of patients with piriformis syndrome, they usually respond really well initially to just stretching the muscle. A simple static stretch. Now, there's a lot of people also that on social media that say static stretching it doesn't do anything. It's not good. Look, can static stretching impact your ability to lift heavy weights and negatively impact competitive performance if you do it beforehand? Yes. Does it protect you from injury? No. However, if you're diligent with a static stretch, will you see an improvement in flexibility in that muscle? Absolutely. If you're diligent about a static stretch and do it every single day, that muscle will improve in flexibility. I promise you that. So if you got somebody with piriformis syndrome, especially if the symptoms are very irritable and severe, I don't think it's actually very wise to start with strengthening. In fact, I would actually start with stretching and potentially only that, and maybe do some core activation exercises, some core stability stuff. But I'm not going to go jumping straight into strengthening. We're going to start with gentle static stretching of the piriformis. Now, if somebody comes in and they got tightness and weakness and they're much less severe, less irritable, maybe I'll do both. But ordinarily, a combination of both stretching and strengthening in the entire plan of care is usually what works best for these people, not an either-or approach. If they're more irritable, I'll start with stretching and then eventually gradually incorporate some strengthening exercises into this external rotator group. Okay? So don't fall into this stuff where you buy into this either-or mentality. Look, whatever works for the patient, and I can tell you that in the vast majority of cases, stretching of the piriformis really helps their symptoms. But again, to keep it from recurring, we probably want to strengthen these muscles either from the get-go or later on in their plan of care. Now, the first thing we're going to talk about here is stretching. And I preface this with a question. What is the best piriformis stretch? Well, I'm going to show you a number of them, but the best one is the one that allows the person to feel the stretch in the piriformis and really the external rotator group the best, and without exacerbation of symptoms. So if I try 2 piriformis stretches, and one of them they don't really feel at all in the piriformis, and the other they do, well, I'm going to go with that second one. If I got 2 stretches, and one of them, let's say they feel both of them equally, but one of them produces symptoms down the leg, I'm going to go with the one that doesn't cause symptoms down the leg. So I've had multiple patients with tight piriformises, and every one of them might get a different stretch, and it's based on which one they feel the most. So before we ever get into strengthening exercises, let's talk about some really good piriformis stretches. And by no means is this list complete. There are some other ones certainly that you can find online, or you may know some. You can comment those in the comments. But these are just some good starter stretches for the piriformis. Let's take a look right now. So the first piriformis stretch we're going to be looking at is a standard one and sitting here at the edge of a table. This is the one I find that benefits most patients initially, but you always need to check in with your specific patient because this one, for whatever reason, may not be as appropriate for them as some of the others we're going to take a look at through this video. So to perform this one, you're going to take the side you're stretching, in this case my right side, and cross that ankle up to the distal end of my opposite thigh. The goal of this is to feel a stretch right in the buttock, right there on the side. What you're going to do is sit up nice and tall. You don't want to slouch for this. Actually, slouching will take some off of the stretch. So sit up nice and tall. Bring your hands underside this knee, and while you're sitting up tall, gently bring this thigh towards your chest. If the patient's super severe and irritable, we want to make sure that this stretch is not causing symptoms down the leg. Some people might say numbness and tingling are okay. We definitely don't want shooting pains. So if this position causes shooting pains, we might ease off a little bit, okay? But for severe and irritable patients, I might start with 30 seconds. If they're a lot less severe and irritable, we might go a full minute. But generally speaking, older adults are going to benefit a lot more from the 45-second to a minute range for static stretching like this. So that's your standard sitting piriformis stretch. Now, some people actually report feeling that muscle stretch more when they actually push down here. So you can either push with your hand here or use your forearm, but again, you want to make sure that you're sitting up nice and tall. Now, personally, I don't feel this near as much in the piriformis as I did the first one, but every patient is different. You need to communicate with them, okay? So those are your 2 main ones in sitting. Now, another really good one is on the table edge. Now, some people call this a modified pigeon stretch. I usually just call it a table edge piriformis stretch. So I'm going to stretch my right side again. I want to approach the table so that the table edge is on my right side, and then I'm going to sit down like this. So my right hip is in external rotation. What I'm essentially going to do is, again, not slouching, trying to keep my back straight. I'm going to slowly, maybe using the table here, pull my chest toward this thigh and try to feel a stretch in the piriformis. If you've got an individual who already has decent flexibility in that muscle, they may not feel this one. But if somebody has really tight external rotators, they probably will feel this. And then we can hold that anywhere from 30 seconds to a minute. Now, if you really want to challenge that, you can go full pigeon, meaning you can bring this leg back like this, and then go into this stretch here. And again, you can gradually sink forward, keeping that back straight as much as you can. You're going to feel the hip flexors in the opposite leg, but you don't have to do this to necessarily get the piriformis. You can just stick with this one, okay? Now the last one I'm going to show you is one in supine. I don't usually give this one a whole lot, mainly because for the patient population that I see most, they actually have a lot of trouble getting into this position and then grabbing their leg, okay? So this one's going to be on the back, and we're going to get in a figure 4 position like this, okay? This is the piriformis that I'm stretching. The other thing that's a problem with this one is that if a patient doesn't have a 100% crystal clear understanding how to do this, they may just grab this leg. You don't want to grab this leg, you actually want to grab this one. And you're bringing this thigh toward your chest. And by pulling my left thigh towards my chest, it's actually pulling this leg towards my chest and getting a little bit of a piriformis stretch here. So that is a non-exhaustive list of some good piriformis stretches. Give those a try, but always check in with your patient. So you've got 2 patients with piriformis syndrome under your care. Your first one, when you evaluate them, they are high severity, high irritability. That patient is probably not going to respond as well to jumping straight into strengthening. That patient's probably going to initially respond well to the stretching that we just looked at. Maybe throw in a sciatic nerve glide. We'll look at that in other videos. Maybe some gentle core activation, some supine pelvic tilts, that kind of stuff. And then once their symptoms are down, then introduce the strengthening exercises. Your second patient, low severity, low irritability, I'm still probably going to give them a stretch if that muscle's tight, but we'll probably jump right into these strengthening exercises that we're going to take a look at right now. Now, the first clamshell variation I'm going to be showing you is the standard clamshell. Let me just show you the movement real quick so we're all on the same page. Feet stay together and the top knee comes up like that. That is the standard clamshell. It's the one that's used in pretty much every clinic across the globe. It's used in EMG studies that are investigating activity of the gluteus medius, the standard clamshell. And in this video and in my clinic, we term this level 1 clamshell. Now, levels 1, 2, 3, you're not going to find those in any literature article. That's just terminology that I created for myself to help differentiate which one we're actually doing. But with the standard clamshell or level 1 clamshell, there's a few nuances here that I think are important to point out. One is the band position. The band is really the best way to get more resistance on the gluteus medius. And I have it just above the knees, right across both thighs. You can put it right across the knee joint line or even a little bit below on the top of the lower leg, but this is just a personal preference. Now, what is not a personal preference is the second nuance, and that is the relative position of my hips. As I am laying right here, my thighs are a little bit more in front of my body. Now, the gluteus medius is more of a posterior glute muscle. It's a little more on the side than the gluteus maximus, but it's still posterior. So to really get more activity there, what I actually need to do is I actually need to keep my knees bent to 90 degrees, but I need to shift my legs a little bit more backwards. They don't need to be behind the frontal plane of your body, but if they're too far forward, you're not going to get very good gluteus medius activation. And if somebody doesn't yet have that mind muscle connection and those muscles are really weak, they're not going to really feel it as much if the legs are in front. So we want to get them a little bit more behind like this. Now, as you start doing this, you may notice that people start doing this rocking thing. They're not able to really control the spine, particularly the lumbar spine, as they're bringing this up. There's a number of reasons that that might be. It could be that their core is not producing enough stability there, and so their lumbar spine is rotating. It could be that the gluteus medius is not very strong. One way to circumvent this is to have them hold on to the edge of the table around jaw level, right here. And what you're going to have them do is pull themselves in isometrically. You're not actually pulling yourself over, but you're really just holding tight there. And what that does is it braces the core. And when you brace the core, the spine's less likely to rotate, and so you can really isolate that hip movement more. So let's take a look at that. Pull yourself in, brace the core, rotate up, and notice there's really no spinal movement. The next exercise we're going to be looking at is known as a piriformis bridge, or an external rotation bridge. This exercise is amazing for strengthening hip external rotation once the standard exercises become a little bit too easy. So to do this exercise, you're going to need a bench like this, preferably one that's about this height, and there's some space under the end of it, and you'll see why in just a minute. So I'm going to do this for my right piriformis, or external rotator group. So to do this exercise, I need to get up really close and personal with this bench. And I need to rest my leg on this such that this hip is in external rotation. Now notice that the edge of my knee is in contact with the bench. If I'm too far out like this, that's going to put a lot of stress on the knee. We don't want that. So get up real close to the bench, pretend like you know each other. I'm going to have my other leg here, either, depending on where I am on the bench, either under that, that's why you need some space there, or at least have the bench positioned where this leg is next to the bench and nothing's in the way of that leg, okay? So we're gonna have our arms by our side, and we can even press through into the floor, some shoulder extension to get that core braced before we actually do the movement. What I'm gonna do is I'm going to press this leg into the bench really hard. I often have people practice that before we even do the bridge itself. So press this leg into the bench really hard. You should feel the glutes contract, and you might even see the glutes lift a little bit off of the ground. That's what we want for this bridge. With this foot, I can either have this in contact with the floor for a little assistance, that's going to make it a little easier, or I can keep this leg totally elevated in the air. Either way I do this, I want my pelvis to remain as steady and level as possible. I don't want it tilting either which way. So let's see what the movement looks like. So again, press the arms into the floor, really engage the core that way, and then bridge up. You should really feel the glutes right here on, at least in this case, the right side contracting, and then come back down with control. Continue pressing into the floor. Inhale on the floor. Exhale, bridge up as you press this into the bench. Again, the major component of this force is coming from this being pressed into the table as hard as you can. Now you can make this exercise more challenging by holding a weight on your lap here. The only problem with that is you won't be able to press into the floor, but presumably if you're able to do this with added weight here, in all likelihood, you probably have enough core stability where you don't necessarily need to even push in here. Just make sure you're not getting excessive lumbar extension, because what we're working on is the glutes. So you would hold a weight right here. Again, press into here. Really engage those glutes. As you're up at the top here, you can even press harder into that table to really engage those external rotators, and then come down. That is a piriformis bridge. So the next exercise we're going to be looking at is known as a piriformis good morning, or a piriformis hip hinge. The best way to do this exercise, especially for beginners or individuals who have a little more meat right here, is going to be to do this on a decline, a table or a bench that has a decline. In other words, you are facing the direction where the table or bench is going downhill, going down the decline. This can be done on level ground, on a level table, level bench with no incline, but it's going to be a little bit more challenging, especially if you got some meat right here that's going to hit your thigh. That's going to limit your range of motion that you're going to be able to achieve on this. So for that reason, my preference is to use a decline bench, as you see right here. Now with this exercise, I'm going to be working my right side. So that right hip is in external rotation. My left hip is back here, technically in an internally rotated position. And when I do this, I want pretty much all the force coming from this right leg, particularly the right hip. So in order to accomplish that, I'm going to de-weight this knee from the ground so that only my foot, or my toes in this case, are in contact with the floor on my left side. I want that level of pressure or force from those toes over here to be exactly the same throughout the entire movement here, okay? So what I'm going to do is I'm going to keep my back straight. In other words, try to keep my chest up as much as possible, and I'm going to hinge forward. I am pressing my thigh into this bench as I go down. I am actively pressing it. And then I get down to a point where my chest is hitting my thigh. I really can't go anymore without bending my back. And then I'm not going to use my paraspinals or my hands to come up, or this leg back here. I'm going to drive my right thigh into this bench and press up. I don't want any change in the force from those toes on my left side into the floor. No change at all, especially no increase. Let's do that again. Keep the back straight, keep your chest up. We're going to hinge forward. I am pressing into this bench. You should feel your glutes working here, and then you're going to press in even harder and come back up. That is a Piriformis good morning or hinge. To make this more challenging, you can either progress to level ground, or you can add a weight and hold it in your hand here by your chest. Come back up. Another really great way to train the piriformis muscle is using a Roman chair, as you see right here. Now, there's a specific way we're going to train this to get the piriformis. We're going to go over all the considerations, ending with the most important one at the very end. So one thing we don't want to do is kind of rush this, and especially with this lumbar hyperextension. There's nothing wrong with training lumbar extension if that's your goal. But if your goal is glutes or the piriformis, that is not what you want to do, okay? If you're training piriformis on this, at least in part, your prime mover is still going to be the glutes. So you want to get really good at feeling those glutes squeeze as you come up and not feeling it in the low back. Hamstrings will work a little bit too, but we want the prime mover to be the low back, okay? Now, the other important consideration you're going to see on the corner of the screen right here, it's my foot position. So if you have the feet pointed directly forwards as you're doing this movement, you're not going to get as much piriformis. And remember the reason for that. As the hips extend, the piriformis is functioning as an external rotator. So we can get the piriformis more strongly by externally rotating the hips, and do that by pointing the feet outwards, and then going through this hip extension. So you want to make sure glutes are the prime mover, feet are externally rotated, therefore the hips are externally rotated, and that's going to get your piriformis good. So, hopefully this video gave you some good ideas about how to go about treating piriformis syndrome, or just generally someone with a tight piriformis. You might need some stretching, you might need some strengthening to really be complete in your plan of care. Please make sure to like this video, subscribe to my channel, and hit that notification button for notifications for all videos in the future. Thank you so much.